we will speak again.
Right.
Okay. Charlotte, you're in control of everything, aren't you?
No, I'm not. I'm clerking, taking minutes. It's Sarah that's producing.
Sarah. Okay, Sarah. Thank you. Well, good morning, everybody. This is the meeting of the Isle of Wight Health and Wellbeing Board for Thursday, the 15th of October. This is a virtual meeting due to the current coronavirus restrictions, and it's a meeting in public, and we have a range of partners with us today who will be dealing with the agenda as has been publicly circulated. Can I just remind people on the call, if when they're not speaking, they wouldn't mind muting their mics and probably taking off their mobile video as well, so that we can give clear communication. So I will just start with the agenda, which is shown as follows. First of all, the minutes. Now, the minutes of the last meeting, which was in 23rd of July 2020, have been circulated to members of the board, and I would just ask if they're happy that these be accepted as an accurate record, or if there are any changes that anybody's identified that need to be done. If you could turn your mics on now, and I'll just take a collective agreement to that. So are members happy for that?
Yes.
Yeah. Any
Yes.
Thank you. If there are any objectors, you can either raise your hand or flag it in the chat line box. That'll be fine. If not, take them as read then.
Yeah, agreed.
Thank you. Thank you, members. I'll now move then to item 2. Again, if you could just turn your mics off, particularly while we go through. This is the declarations of interest. Having circulated the agenda for the meeting, are there any members have any declarations of interest they wish to make, which are not already covered through their various partners' register of interest? You could indicate that by coming on the microphone. Thank you. None indicated, so we will note that. Can we now go to item 3? Oh, just before we go there, I'll deal with it in Chairman's update. Item 3 is public question time. Sarah, have we any questions from the public for the board that I need to address? I'm not hearing anything.
We haven't had any.
Okay, so we got no public questions for the board at this time. So I'll now move to item 4, which is the Chairman's update. First of all, I'd like to welcome, as a viewer, Norman Arnold. Norman is the chair of the Economic Development Board for the island. And one proposal which we'll discuss shortly, and probably under the recovery plan discussion, is inviting Norman to join the board so that we can respond to the economic impact of the COVID-19 recovery plan. So welcome as an observer, Norman. Can I also mention the second element for me, which is the economic situation on the island, which I am concerned about. I now have the statistics for unemployment over the last almost 6 months now, and we'll have the further ones in October. And there are 2 significant points for the board to be aware of. First of all, where we would normally expect to see our peak in January, because if we've managed to extend our season, it is actually peaking in October. And secondly, when I say it's increasing, they are over double what they would normally be, and we're talking of figures in excess of 5,000 unemployed already. So this is quite a concern, I think, not only from the fact that people are losing jobs, but there's also the health impacts in terms of mental health, etc. So I just bring that to the board's attention. And we are also going to deal with the mental health pathway today, so that'll be irrelevant. Any comments or questions on item 4 before I move over to Chris Ashman? No. Okay, then can I go to item 4? Now, item 4, Chris, we've got 3 areas in there. One is the COVID recovery plan, which I know you're going to cover. Then we've got the health and wellbeing strategy disparities, which I think is Simon, and then the wider mental health issue, and I'll come back to that shortly. So if I can go to item 5 then, Chris, do you want to take a presentation position on that? Is that okay? Thank you.
Thank you, Leader. Just wanted to obviously introduce the report which we circulated to board regarding recovery plan, and I don't want to necessarily go over the obvious issues connected with the pandemic, but I think it's worth just reminding the board of how the Local Resilience Forum usually plans and responds to significant events such as the COVID pandemic through 2 phases, the response phase and the recovery phase. And in most incidents, those are logical and progressive events. The event happens, the response to the event takes place, and then organisations are charged with recovering the previous position, whether that's a flood, a fire, any of those types of incidents. As we're all aware, this particular incident, the COVID pandemic, is an ongoing challenge. So in that circumstance, the ability to complete the response phase and move on to concentrate on recovery, however significant that might be, is compromised. So we are in, as we always keep saying, unprecedented circumstances as far as this recovery and local resilience structure is concerned. That being said, whilst we still have our obviously our challenges around a further infection, we are at the moment experiencing some of the lower rates of infections in the UK, and as a result, we can try and begin to plan around recovering from some of the worst impacts. You, in your remarks, commented on the unemployment situation, and clearly the need to act on that in terms of recovering from what is a worsening picture cannot wait until we have a clear position on the infection risk of the pandemic. And also on other factors in relation to recovery, we are able to navigate a path through a recovery plan that enables us to try and mitigate the worst effects of the incident, of the COVID pandemic incident. So the recovery plan, in essence, seeks to do that. It does actually provide a structure around how we can organise and promote recovery across the island. And it identifies 3 key pillars: community recovery, that looks at that wider wellbeing piece; economic recovery, focusing on the prosperity agenda; and impacts on place. And what the plan does is it identifies clearly some short-term actions where we're able to identify an increase in economic recovery, but also it identifies longer-term challenges. So, for example, we're developing the whole approach to land use planning on the island at the moment. So to ignore the impacts of the recent months in doing that would be irresponsible. So looking at the development of our island plan for the longer term and how then we organise and develop the island would be an important thing to consider, bearing in mind the effects of this type of incident. So obviously members will have had a chance to look at the recovery plan, consider the action plan as the appendix, and the report then also suggests, as was discussed at the Isle of Wight Cabinet, that this board, given its position looking at the wider aspects of well-being, becomes the oversight body for further development of the recovery plan. It is going to be a flexible feast, really responding to issues and opportunities of recovery as it moves forward. So its further development and its success requires collaboration and strategic oversight, and obviously involvement by the range of partners represented on the board in enabling a successful recovery. So to that end, the second recommendation in the report highlights the the need potentially to link more directly with the Economic Development Board that obviously takes forward the future sustainable economic development of the island. That board has been in existence for nearly 8 years and has been progressing a range of interventions to ensure that the diverse business base that we have on the island is sustained and grown and responds to the skills agenda, for example. So highlighting this board as a potential oversight, there needs to be a relationship, and the suggestion is, as you referenced earlier, Leader, the report recommends that the Health and Wellbeing Board's membership is expanded to include the chair of the Economic Board. So I'll pause there, Leader, and take any questions on the thrust of the plan, and also anything on the specific projects and activities within the appendix. And obviously I can update and answer any questions or queries board members might have on that.
So thank you, Chris. Simon Bryant will probably wish to respond first of all onto this, and then I'd like to explore and make sure that the Health and Wellbeing Board fully understand what is being proposed in terms of oversight of the plan. Simon Bryant, are you free to speak?
Many thanks, Leader. Chris, I really support this approach, because we know that the Health and Wellbeing Board is overseeing the health and wellbeing of the island, and I think the links with economic development are absolutely key, and I think that's really welcome. I think it's just really making sure we remember that our remit is health and wellbeing, and economic recovery is part of that, and economic recovery sits alongside it at the same time. So it's just making sure that we're cognizant that we are that's our core focus, and that's right. And as part of that, as Chris outlined, we need to protect our health of the population from the COVID pandemic. So we just need to kind of balance those up together and be cognizant of our role as the board. But I'm very supportive of what Chris is suggesting, and
Yeah, thank you, Simon. I think that's an extremely important point that you make, and I think the board need to appreciate it doesn't take away our focus on health and well-being. This will be an arm, and I think the cabinet would be focusing very much on the economic impact on the island, and that through me and other members who are on the board, we will be able to inform the Health and Wellbeing Board of what is progressing on that aspect. So thank you for that, Simon. I did see a number of hands and questions. I'll try and pick them up. Sarah may be able to see the names. They've shot away from my screen now.
Leader, it's the Chief Executive. You've got a question from Councillor Lilly.
Thank you. Councillor Lilly?
Hang on.
Yeah, just
Hello
unfree your mic, Michael. That's good. Yes, thank you.
I won't put my camera on, but
no, it's okay. We know what you look like.
Please, sorry, Leader, Chairman, if I may, Councillor Lilly, if you could please, because we are broadcasting to the public, so the public can see you speak. Thank you.
Okay, you can see me.
Yeah, just get a few seconds, Michael, and just so you'll get it will show live then as well, so that you can be seen and heard.
Am I seen and heard now?
Yes, you are.
Okay. I put in the chat bar the pages. I'm relating to page 13 in your report, Chris, and I've just got one or two points, and also I'll then refer to page 23. On page 28, you actually say about the summer months, right? Where obviously we started to have some of our season back, right? Yeah. And people came onto the island, right? And obviously there was a lot of apprehension about whether, that would cause a peak, right? And we had this very difficult choice, which, and I commend the Isle Council and the leadership in tackling this difficult balance, which was obviously trying to get our economy going as well as preventing the pandemic going further. Do we know now some of the outcomes of that? So, for instance, the amount of visitors, how it affected our economy, because actually against the cases, even though we've had a recently increased of cases, the Isle of Wight still is one of the, well, I think it's the lowest in the UK. So obviously we were able to withstand with I think incredible numbers of visitors. I mean, Ryde was in August absolutely chock-a-block with visitors on our beaches, and there was real worry. But it'd be just interesting to know what the actual facts and figures of that and lessons learnt from that, because we're obviously doing something right in that process. The other particular point on 31, I wanted to raise the fact that Community Action Isle of Wight got funding to do resilience work, and the Community Resilience Project would be useful to circulate to all members of the Health and Wellbeing Board, because that is looking at particularly the work of all the community hubs, which were obviously essential complementary service to the Isle of Wight Council through that through the COVID, and still is. I mean, it's still operating very well, and some of those members, particularly in West Wight, who actually got honours. Mary Griffin got honours through that for all the great work that they did. So we've got a lot of lessons learned that link into the community recovery, and I know Ian Lloyd has been particularly working, and yourself, Chris, in that regard. And the final point on page 23 I wanted to raise, where you talk about the environment, and I'm glad to see putting, the climate emergency and the economic benefits from that we could on the island develop that. I wish to add to that, which is the environment is extremely important on the island for our health and well-being. We are very lucky to have an environment which people in Birmingham would absolutely die for. We have got beaches, we've got all the things, and I'm talking about a mental health professional for nearly 35 years experience. We don't use our environment enough to actually have in our health and well-being of our community. We have such a fantastic resource. We could economically sell our island as a health and well-being island.
Yeah, thank you, Michael. Did you have a question, by the way? Thank you.
The question was about the outcomes over the summer.
Okay, thank you. I'm not sure it's purely Chris's response. I'll just enlighten a couple of things there, which are for your benefit. So, in relation to the summer, I'll ask Simon if he has any data on that. What I can tell you, because I mentioned unemployment, the current rate on the island is 6.3%. And that was the last time we saw that was pre-pandemic. The other thing is we've yet to see the end of the furlough scheme. Just bring that to attention. Can I ask Chris if there's anything he wants to respond to Michael's points? There were three he mentioned: the season back and the peak and the lessons learned. Also the community resilience. And I think on that, I would echo what Michael said in terms of those that were receiving of awards in the Queen's Honours list. But I'll probably extend that to all those unsung heroes who did a fantastic job across the island and stand ready to do it again, from what I understand. So, Chris, if you respond, and then anything you can't answer, I'll go to Simon, and then I see I've got John Metcalf who wants to speak as well.
Thank you, Leader. I'm afraid I don't have the specific figures in relation to visitors this year. The period will have been up to the end of September, but we're obviously in regular liaison with Visit Isle of Wight, and we can circulate those specifics. We have obviously anecdotal feedback in relation to the island being a popular destination, and clearly the efforts that the council referred to, that colleagues initiated to have a proactive campaign of welcome, but a careful welcome to the island, proved to be successful. So the council is absolutely right to learn from that experience, and obviously to manage that behaviour issue as the tourism season reactivates. I think the worrying thing is that obviously the national picture as far as the infection rate is concerned, and obviously the introduction of restrictions in other areas may have an impact then on the potential for that season extending into the autumn and the winter period. So whilst it may have been encouraging, and we'll circulate those figures, we still obviously have the challenges of this winter and next year to negotiate. We'll obviously be able to update the board through the Economic Board. Visit Isle of Wight are members of the Economic Development Board, so we can obviously update on that particular point. On the resilience point, members will note in the action plan for the recovery plan, the appendix, it highlights the need to establish sustainable arrangements for the community hubs, and it references in the first 3 months the intention by Community Action Isle of Wight to put in place that resilience coordination. So in essence, the successful award of that lottery funding is a first step forward in that particular part of the action plan. And then last but not least, I think it's just worth again referencing in terms of the appendix, the obviously progressive implementation of the mental health plan. Mental well-being is clearly a major concern for recovery and enabling people to see themselves through this challenging situation. And in terms of the wider environmental benefits that the council refers to, I know that our mental health teams are progressing specific projects to encourage people to use the outdoors and use the fantastic environments by organising walking groups, for example, in different parts of the island. So a very key part, the environment is a very key part of that mental health plan implementation agenda.
Thank you. I'm going to go through a list here, which will probably complete all the points as well. John's got a comment, which I'll go to John Metcalfe first. Ian Lloyd can probably touch on the community recovery aspect, particularly in relation to the community hubs. Zonia O'Donnell, who's with us, is going to circulate a report to do with the community resilience project. And I'd probably be interested as well if Maggie has it to hand, just how the impact of the summer visitors, how that played out with the hospital, because obviously when our number one priority has to be to keep that NHS hospital not being clogged up, in my language, not the right language, I'm sure, but making sure that they've got the resilience to cope. That seems to be so important. So if I take it in that order, John Metcalfe.
Yeah, thank you, Chairman. I think I just wanted to go back to a previous point about the plan. So I think Simon's point was very well made about the responsibility of the board to be for the well-being of the island, the health and well-being of the island's population. Of course, the economy is a key part of that, but built into this plan is the recognition of the need to do work around test and trace, work around how we advise people, keep people as healthy as possible, work around flu vaccinations, which are all really, really important as we go into the coming season. So I think it's sitting the plan here. So the health and everybody who's connected with the health and being of the island in whatever capacity can see where things are and how things are developing is really, really important. I also just want to make a point about the summer season, really. And what I wanted to do is pay testimony to everybody on the island, because I just think it was a collective effort, whether it was the health sector, community sector, or the community itself, businesses, the council, and the voluntary and community sector. I think in terms of how we worked collectively together to put messages out, to respond to our activity, to work with either the ferry providers or with visitors to make sure that we had very robust plans in place was really powerful. And I'm hoping that we'll be able to carry that energy forward into the winter season, so that everybody on the island, whether they're in business, whether they're just a member of the community or they're working for another part of the sector, will really carry on reinforcing the important messages about hands, face and space, because those practical measures around social distancing, good hygiene, not getting too close to people, and wearing face coverings when important. I think the island population have adapted to that really, really well. And I think that's put us in a very strong position as we go into the summer. But what we can't do is let our guard down at all. And I think that is the message that I know we're working on with colleagues in health at the moment, about making sure we don't let our guard down and carry on doing what we've been doing. And that's a real strength for us. Thank you, Leader.
Thank you, John. If I go to Ian next, then Ian Lloyd.
Thank you, Leader. I'm just putting the camera on. So yeah, just to pick up on a point that Chris made in terms of establishing the sustainable community aspects of the response. So as the board will probably be aware, we've moved from a crisis response phase for the community, where we have paused some of the original crisis activities, but that's not to say that they've been forgotten about. There are aspects that continue. And the plan at the moment is that we're obviously looking at through Serena and community action in terms of that sustainability for the community partnerships, bringing the hubs together, maximising that effort, that support. And I note that Serena has shared the report, which will probably cover it off in more detail. I think there are a few other aspects that the board need to be aware of as well. And it is all about the what if scenario. So if we have a situation where, due to a second wave or an outbreak, we need to respond through the outbreak planning. I have a responsibility as the Vulnerable People theme lead to ensure that we've got plans in place that we can step up any provision that we need to. And as part of that, we're looking at aspects around crisis funds. So we've received government funding from DEFRA, where we're just finalising the allocations of those to support crisis needs, and that links back to the unemployment, those that have lost jobs are subsequently experiencing hardship, access to food and other debt support. We've got also the preparations in place now, starting to work up our plans should there be a shield aspect to be brought back in. We hope not, but just in case aspect is working out our plans in terms of what that response would look like. Second time around, shielding would be very different. We've just received the shield framework from the government 2 days ago. We've already been making plans, and through theme leads, they're looking at their plans to bring that in terms of how that links to it and what our response would be. But the key message on that is around what we do with communications, continued communications. So members will probably be aware of the self-isolation toolkit that the council has been continuously promoting, and we will continue to revise and reflect on that to support the community. And finally, the test and trace. There's 3 aspects to this, and the 2 key ones will be about the local test and trace provision. So we're working up a local test and trace response helpline, which will make contact with local residents where the national body has been unable to do so. And just on Monday, on the 12th of October, the self-isolation support payment process went live. So there are a number of factors that have been moving forward, and it is all about that preparation for any increases in demands and needs. So thank you, Chair.
Thank you, Ian, for that. That's very informative. I think I've dealt with it. I think Zonia, has Ian covered the point, or is there anything you wanted to add to what Ian has said?
I just want to say that I emailed a couple of pages update report to Charlotte, who is assistant with minuting of this meeting, and it will be circulated with minutes to all members of the board, and it could be made a completely public document if it is required to put on the website.
Thank you very much for that. That's very helpful. Is there any other member of the board wants to speak on this particular topic, which is the COVID-19 recovery plan? And if that, Maggie, did you want to speak on this aspect?
Dave, when you were preparing for this item, you mentioned about bringing me in to say how we cope during the summer.
Yes.
And I'm sure Simon is much more able to talk about the science and the hard evidence behind the numbers and the infection rate during that period. But I would echo the comments that John made. I think we had a really unified approach to managing this season, and that unified approach through the work that both primary care and social care undertook prevented my services being overwhelmed during that summer period. So we saw an increase in activity, but we never became overwhelmed as a result of it. I think one of our conversations here in my organisation has been that the summer season followed so closely to the lockdown period that the R rate was lower across the country than it's becoming now.
Yeah.
And I'm sure Simon's much more able to talk about that than I am. So I think the summer came really, the season followed that intense period of lockdown, and we no doubtedly benefited from that as well. Thank you.
Thank you for that, Maggie. And just building on that, I think a really opportunity with October coming up, if we can actually monitor how things do play out during the half term, because you make a really valid point. I think we are all under a different position than we were back in July. And I see even in the news as we speak that London is now moving up a tier. So there is going to be some impacts from elsewhere. And I certainly have received a number of emails from local residents concerned about what that could be in terms of people coming to the island. And whilst we welcome people, we also welcome them following our guidelines, which is really important. Simon, did you want to add anything to what you've just heard on regards to the data?
Thank you, Lena. Really happy to update. As Maggie said, the summer period when followed this period of lockdown, which really brought our infection rate down and our R rate down really low. What we're seeing now is that increase of infections, both nationally but also locally, but locally to a much lesser extent because we have a smaller number of cases. So that's really positive. We need to really be mindful of that and continue not to be complacent and really ensure we do all we can to prevent the spread of infection. And as you say, moving forward, we know it takes about 2 weeks for an intervention to take effect. So we're kind of watching very closely what's happening in London and other areas to ensure that we can manage spread of infection. As you say, half term's coming up. We need to be really mindful in half term with those kind of occasion events coming up, such as Bonfire Night and Halloween, etc., that we are really mindful that we need to continue with social distancing, continuing to give good hand hygiene, wear face coverings are required, because it's really important that we continue the good place that we are on the island at this point in time, and we don't and we prevent a rise in infection as much as we can. But as residents are saying, we are seeing a rise in infections locally and nationally.
Thank you, Simon. So I think in terms of this particular paper, then we've got 2 recommendations which we're being asked to approve, if that's the right phrase, as a board. Is there anybody else wishing to comment on the particular proposal at one of the recommendations that we invite the chair of the Economic Development Board to join us on this board? I think the purpose in simple terms is that he is then cited on what we're doing and we are then cited on what he is doing, and it meets that priority that Simon pointed out, that we're a health and wellbeing board, but that we have an economic arm to what we're doing, because one seems to lead into the other in many different ways. Claire, did I see your hand up? Do you want to comment on that?
Yeah, I just have a question. Can we just hear from Mr. Arnold how he will report back to the rest of the business community? We have been down this road before when we worked with the voluntary sector, and they are huge and it's really difficult to report back through. So how will Mr. Arnold, if he sits on this board, be able to report back to the rest of that business sector?
Okay, Norman, 2 things. I know you weren't expecting a question, but did you hear the question?
Yes, I did. Thanks, Claire.
Okay.
The board comprises representatives from Federation of Small Businesses, Chamber of Commerce. Between the 2 of us, we're covering more than half the businesses on the island. We've also got obviously Isle of Wight tourism on there. We are a small group but representative, and the idea being that we then pyramid down, we tier down from where we are and get information out. So it would be a 2-way flow from here would be the concept. Is that okay?
Yeah, thank you. I'm happy with that answer.
Okay, if I could just go around members, just to Sarah, do I need to formally have those 2 recommendations put, or in this case, can we take them as read? Don't know if you picked that up or not, or John may be able to respond on that one.
Chairman, I would suggest that if that's the mood of the meeting, if nobody's against it, then you can accept the recommendation. So okay. Just confirm no one's against it.
Okay, so just asking then, members, if you want to put your mics on to sound now, so we can hear you. You can just say verbally that you're happy. If anybody's got an objection, speak louder than the others.
I'm
Happy.
Yeah.
I agree.
Happy with that.
Okay.
When you get my vote.
Okay. So thank you for that. So Norman, welcome to the Health and Wellbeing Board. I'll send you your homework list at the end of the meeting. But no, we're genuinely welcome, and I'm sure you'll add value to what is a really important board in my view, because it is about the health and well-being of the Isle of Wight, and that's what we're all about. So there's one common purpose there. So there we are. Thank you very much. Chris, thank you very much for your presentation of that report and taking the questions that you did. I'm now going to move to number B, which is health and wellbeing strategy disparities. I think Simon Bryant's going to deal with that, and there's a paper we've been circulated. Simon.
Thank you, Leader. I'm just trying to share. Well, people have got the slides, so maybe it's best to talk through those in your pack. That might be the easiest way to do it.
Yeah, Simon, would you be able to just touch on your screen on what is slide display? So just so that we see the one big side rather than all the little ones on the left. It probably make it clearer to see.
Has that worked?
Not yet. So that's it. Yeah, you've done it now. That's brilliant.
Brilliant.
Thank you.
And firstly, apologies to the board because, as you're aware, I'm Director of Health in Hampshire, and one of the Hampshire slides slipped into the presentation published on the pack. So I just apologise for that. The content and the disparities are Isle of Wight figures, let me assure you of that. So I really wanted to talk about health inequalities and really give a focus from the disparities report that came out from Public Health England, because as a board we're really absolutely committed to tackling inequalities, and it just felt really important at this time to really note some of those. So in this report I've picked out a few inequalities issues around the themes of starting well, living well and ageing well, and then particularly some of the issues around the disparities report for a discussion rather than saying this is the answer. First of all, on this slide we've got the ICS, which the local Isle of Wight ICP is part of, and just to show there is commitment across the NHS to tackling health inequalities, and I lead that board with a chief executive of Hampshire Hospitals for the ICS to focus on disparities, inequalities across the patch and how we do that, and this board is part of that board, that kind of process. Just wanted to put on life expectancy so we can see where we are. We have good life expectancy, but you can see if you look at the graphs really carefully, the scales are slightly different. So males have a lower life expectancy than females. So we're seeing that inequality there straight away. But when we think about healthy life expectancy, so and the inequality gap, you can see that the gap between life expectancy of those who are least deprived and most deprived is a gap of a couple of years for males and 2.5 years for females. So we just need to really think about that in the context, because one of our key indicators for the Health and Wellbeing Board is tackling and improving life expectancy. So that's a really important indicator for us to think about. However, it's quite hard it's not something you can tackle on its own. So as we go through this report, we'll see some figures that we want to think about. So when we just look at this report here, we can see a number of factors in this graph, and I won't go through in detail, but you can see at the top the most deprived communities and at the bottom the least deprived. You can see a number of factors there where inequalities play a part in the difference in outcomes. So we've got vaccination coverage, an example there, hospital admissions to self-harm, obesity, underage conception and smoking and pregnancy. And they're all things that we need to think about if we're going to tackle inequality. And as I was asked by a GP just earlier this morning, so, what do we do about these things? And I think for me, they're absolutely right that we take a universal approach, whether that's working with primary care, whether that's working in our systems, but how do we then make sure that what we're not doing is then disadvantaging one group because they find it harder to access our services or harder to make a change or harder to improve their health. Just moving on to kind of COVID and some of the vulnerabilities that have been highlighted, I wanted to share some of the national data for us to think about what we want to do on the island. So we can see COVID vulnerabilities here and the number of things that make someone more vulnerable to being disadvantaged by COVID. And you can see the clinical vulnerability, the wider risk factors, and then some of the kind of policy things that we want to think about. So going through the slides here, we can see this is around age and sex differences in COVID. So we can see there that differences in diagnostics rates are among male and females. You can see that the cases and the impact into critical care, and then working age males more likely to die than females. So something about the gender there and the age, and how we really think about that going forward, and what we do to think about the males in our population who seem to be more adversely affected by COVID. In terms of deprivation, we know that the least deprived population groups peaked earlier and lower than other groups, the least deprived. So how do we kind of think about that? And then mortality rates were in the most deprived areas are more than double than the least deprived. So we can see again, we might need to take a different approach if we want to think about how we prevent the impact of COVID on outcomes, knowing it will impact on different people differently. This slide, I think ethnicity has really been well highlighted throughout the pandemic. And I know that it's a small population on the island, but it's really important just to think about those population groups. So the two graphs there show a difference, and it was the greatest difference. So that for ethnic group of black males, the expected death is 3 times that of the kind of the population, and white females, it was only 1.8. So the difference between those two groups is really worth thinking about in terms of excess deaths and how we want to support our communities. And then thinking about comorbidities, so those people with different diseases, we know that those with other diseases were much more likely to be impacted by COVID. And I know we're doing a lot of work with primary care to make sure that they can support those people who may be more at risk from COVID now and as we move forward in this second wave of the pandemic. So some things to think about in terms of that disparity report I've just brought out here for discussion to see where we go. And just finally, I just wanted to highlight in terms of aging well, not particularly in terms of COVID, but just in relation to our health and wellbeing strategy, thinking about some of the inequalities experienced at an older age, thinking about financial insecurity, the access to healthcare. So we know that older people access healthcare differently, and that might be for a range of treatments rather than just thinking about services for older people. And then we know that if you live in disadvantaged areas, you have less access to healthcare just in that setting. So I will stop there. I will stop sharing the slides, and Leader, it's really for to have a discussion and kind of open up to the board for conversation about inequalities and how we might want to embed that in our strategies going forward.
Okay, and I'll open up to members if there's any questions or suggestions, and I'll watch the chat line if you either put them there or indeed indicate with the hand up where you wish to speak. Simon, I've got a quick comment from John Metcalf. John.
Thank you, Chairman. Simon, I think there's a huge amount of information there that obviously we all need to take into our planning and our thinking as we set out, whether it's the recovery plan, whether we use it in terms of our outbreak management plan, or whether we use it in terms of planning what we do at the hospital. What, in your view, are the top 3 things that we should be really focusing our attention on over the next, say, 12 months that would make the biggest difference in how we respond to COVID and protect our community?
So I think there's a number of risk factors. I think in terms of understanding those individuals with risk factors, we need to think about how we support through primary care a kind of an approach that perhaps invites them in, has a conversation to help them understand their risk factors and what they can do to change that, whether that be their lifestyles or how they protect themselves, because we know some people are more vulnerable. I think we know that unhealthy weight is some factor that we need to really tackle, not just for COVID, but for the health of the population. And I know that we saw the Prime Minister's paper coming out in the autumn, and from my perspective, my public health annual report will be on health rate. It's been slightly delayed just because of COVID, and it will be coming through to the council in January. We can bring that back here. So I think those are two things. And I think always just being mindful that actually we need to think about inequalities in all we're doing. As we're setting up services or reviewing all our services, just have a mind for actually, you know, particularly around COVID, what do we need to do to ensure that people from a black or ethnic minority can access those services in a way, and are they? And something that I've done in one of my services is what's called an equity audit. So just really thinking about at a very high level, who's accessing my service and does that fit with who I think has the major need? So that really helps people to think about. And it doesn't have to be a long piece of work, but just thinking about the demographics of those who access the service, and then how might we need to change that to make sure everyone can access who needs to.
Thank you, Simon. You're on mute, Leader.
Yeah, sorry, my apologies. Michael Lilly, just pause a second, Michael, to let the live camera come on you. Thank you. I think you're there now, Michael.
Okay. Thank you, Simon, for your report. The two areas that you highlight was, in fact, men, and particular older men as being a vulnerable group, which fits in with ongoing statistics we know in mental health and older men being risk. And you also talk about deprivation as well. And I just, I mean, the thing with deprivation is we also know on the island where the particular deprived wards are. So my question was about targeting these vulnerable groups. What is being formulated to particularly target to those particular groups to make them more aware, and also making sure that they have support and access. We for instance, we know that the Men in Sheds projects have been very successful in particularly getting the message out to men and suicide and depression. So I just use that as an example. Thank you.
Thank you, Michael. Do you want to respond to that one, Simon? And then if anybody else has any comments they wish to make, if you could just
very happy to respond, Leader. So I think in one sense it's really timely with the conversation we've had earlier about regeneration, and I was working closely with Christopher Ashman around the work we're doing about place, because if we can improve the place that people live, that will improve the health of the population. So we take a systems approach to that. And certainly with some of the services around those universal services that I commission around health visiting, we do make sure they're targeted at the most vulnerable. So those people who are least needing the service get a kind of a universal service, and those people who need a little bit more get a targeted service. And I think with regards to the COVID work, we're doing a lot of work around targeting communications in the right kind of way, using social marketing insight work to make sure the messages do reach the people in the right way, because we know that blanket messages are really, really helpful. We need to enhance those with kind of more, as you say, more nuanced messages for different people. I think for me also, if we really understand that, and this board really understands that we need to focus on populations, working with Maggie and the Trust, we're working together to make, we can make sure that people are just a little bit more sighted and minded on that. And with primary care to say, actually, do we need a further kind of thought about particular individuals or a particular way we approach a topic to target those people or support those people, perhaps is a better way of saying, who may be more at risk.
Thank you. May I ask a supplementary question to that?
I don't mind any brief supplementary question.
It was actually particularly around targeting deprived areas and wards, Are public health working very closely with social landlords, particular housing associations like Southern Housing, Sovereign, Vectus? Because obviously they particularly do work in those deprived ward areas.
In general, specific, so as I said, working kind of around regeneration and really trying to improve that. We do work with housing providers to make sure they're trained and support, understand the right kind of information to improve health. But we also know that actually working with those housing providers, as they do more work, and they do an awful lot of work in the kind of supporting health in the broadest sense, that they can have a huge impact. So yes, we work with them, you know, and with our NHS partners on that front.
Thank you.
Thank you, Michael. Is there anybody else wishing to speak on this too, Simon? I haven't seen anybody in the chat line. Simon, thank you very much for that. I did have one question. It probably leads into the mental health element of this aspect. So I don't know how, just trying to recall who was going to lead on that one for us, but I've got a couple of questions that might go to other board members on this aspect. Can you help me there, Simon?
I'm really sorry, Leader, my internet completely cut out there. Can you just repeat your question?
Yeah, so in relation to the agenda, we've covered two elements of the three elements under the this section. I'm just going to spin back to the beginning. But the third element here, which I recall us discussing how we would best deal with this, but I think is a really important aspect, which is around mental health itself and how we're going to manage that, and oversight from a Health and Wellbeing Board perspective.
Yeah.
But I recall our conversation, but I can't remember who was going to lead on that. I'm going to say you, and then feel guilty if it wasn't you.
Yeah.
So I think there's been a little bit of there was, and just to update from yesterday, there was a mental health partnership board chaired by one of my senior team and the CCG. I haven't had the outputs, but a really good conversation there about how we improve mental health and wellbeing across the island. So the mental health paper is from the CCG, and then we can bring forward that conversation about how do we drive forward mental health wellbeing across the system. But I think the papers come from the CCG.
I think, Leader, if I may help,
Yep.
Leslie Stevens is lined up to come into the meeting and talk about it, but we just need to send her an invitation. So, Sarah,
if you could make that happen, could I, in the meanwhile, just ask Maggie and Michelle a couple of questions, because it deals with both the hospital and the out on the ground GPs, and it really was what are you seeing from a mental health perspective? Because we all talk about the impact of COVID on the mental well-being of our community. I suspect it's revealing itself to you probably slightly different ways, because obviously Maggie's at the hospital and Michelle, you're out on the ground with the GPs. But I'd be very interested to see if what everybody talks about is manifesting itself, and if it is, how. And then hopefully John will have got that link in as well. Do you want to take it first, Michelle? Just randomly. Yeah. Let's give it a few seconds. We're going to Michelle now, Sarah.
Thank you.
You're live.
Thank you, Chair. We're definitely absolutely seeing an increase in mental health issues in the community, particularly around anxiety, worsening of pre-existing anxiety, but also new onset anxiety as well. We're seeing increase in people's levels of depression as well, both with anxiety and on its own. I think of particular note, we're seeing quite a lot of young people with anxiety. So people in their teens, early 20s, suffering with anxiety and depression as well. So yes, absolutely, we're definitely seeing what is being spoken about at a higher level on the ground. We're obviously also getting quite a lot of communication and contacts about employment issues, and that sort of related issues as well, which obviously, unfortunately, we can't help with directly, but we can always signpost them to other websites that may be able to support them.
Michelle, thank you for that. Maggie, shall I come to you next, and then I'll go over to Leslie?
Thanks, Dave. And I know Leslie will want to comment on this as well. And as our Director of Mental Health Services, Mental Health and Learning Disabilities, I think if you could let her speak as well, that would be very useful.
Yeah.
But I would echo the comments that Michelle's made. So, you know, it's unusual to see something in primary care that we then don't see being referred on to our own services as well. So Leslie will give you a bit more detail, but we have seen an increase in those who are seeking support from us. Both through referrals from our GP community, but also through direct attendance at RED. But Leslie, would you like to comment?
Yeah, if you just pause a few seconds while they let you in and you go live, that then the public can hear what you've got to say. Okay.
Okay, thank you. I'm sorry, I've just come in quite late into this conversation.
That's all right.
I think across Trust Mental Health and Learning Disability Services, we're back to pre-COVID levels of referrals coming in, but we're also having feedback from service users that they're struggling to access services because of COVID restrictions and anxiety about it. So I think there is, in addition to being back to pre-COVID levels of referral, some potential unmet need there too, and we're seeing an increase in the acuity, severity of illness of people presenting into our services compared to pre-COVID times. So there's no question, I think, that we're experiencing the predicted mental health surge linked to lockdown and the socioeconomic impacts of the pandemic. We also, I think, really strikingly have seen an increase in referrals of children and young people linked to the return to school. And there was quite a significant spike in that period immediately after the return to school. It continues, and I suspect will continue for a while longer, particularly complex issues around eating disorders and so on that are coming through.
That's really interesting. I think Steve Crocker's on this call. I'm not certain, but if he is, I might ask him to comment on the education side. Now I'll just go to Claire Mosder because I think she had. Thank you, Steve. If I go to you, Steve, picking up on the point that Leslie's rightly made, and it was in my mind anyway, how is the mental well-being playing itself out at educational level?
Yeah, thanks, Chair.
You might need to introduce yourself. A lot of people may not know who you are.
So I'm Steve Crocker. I'm Director of Children's Services for Hampshire and for the Isle of Wight. And I'm glad you spotted me, Leader, because I put something in the chat function to say that I'd like to speak. And although in fact Leslie said a lot of what I wanted to say, which is fair enough, and that we've also seen that rise in activity and concern around children and young people's mental health. Probably the thing that I would add to it is that the patterns of children that we're seeing are slightly different. So sometimes, I think what we are beginning to see, children who have not previously struggled with mental health at school may now be struggling. And interestingly, we have also seen examples of where children had previously struggled at school but actually feel okay now. There's something about that, almost like a bit of a break for them from school, helped in their own emotional well-being. So it's a complex picture is what I'd say, but I'd also say that in line with our own activity around children's social care, there is definitely an increase in concern and an increase in activity, and that's particularly being highlighted now the schools are back, because there are more professionals on the ground that are seeing young people and making those referrals in.
Thank you for that, Steve. Claire, I'm sorry I held back. I know you had your hand up a little while, but do you want to chip in at this point and just introduce yourself again for the public who they know, so they know what you cover? That'd be useful, I think.
Thank you, Chair. I'm Councillor Claire Mosdow. I'm the Cabinet Member for Adult Social Care, Public Health and Housing Needs on the island. I think we cannot underestimate the mental health impact across our whole communities. I can always give the example that I had to quarantine for 2 weeks. It is a lot harder than lockdown. And poor Simon Bryant rang me on the Wednesday after I'd done a few days, and all he got out of me was, it was really, really difficult. it made me feel really, really poorly. And most people know that I am probably the most outgoing, gregarious person that you could, be around. But I really, really struggled with it. The fact that you can't go and do those everyday things that you take for granted, like walking my dog, going to do my own bit of shopping. Even in lockdown, we were able to do that. But also, I think we need to highlight the mental health impact this is having for our older people. Even now with low cases, I can give the example of my mum. My mum worries. My mum worries all the time about leaving the house. I fear that at the end of this, a lot of elderly people will become agoraphobic. I think of places I can take her, but it is really, really hard for elder people who've been drummed into them that they are really vulnerable, that they will die if they get this illness. Well, we don't seem to be giving out the messages to them how important it is that they get that fresh air, they go out and they do still try some form of social distancing and meeting their friends, because the long-term implications of this is absolutely huge.
Thank you for that, Claire. So I'm just bearing my agenda slipped away. There it is again. Okay. I just want to double check. Have we covered everything we want to cover under the mental health pathway, Leslie, or am I missing out something? I know we've got your expertise here, and I'm really keen we maximise the use of it.
I think Councillor Brady had a comment.
Okay, Councillor Brady.
Yes, thank you, Chair. It's really just a slightly different angle on this. Mental health does concern me in children, as Steve Crock has just covered off, and in elderly people. Speaking as a ward councillor and speaking from personal experience, I think one of the biggest problems we've got on the island at the moment is people not being able to see their doctors and not being able to get treatment in some of the services at the hospital. And I think that's increasing the worry to a lot of the residents. I know the e-consult system from the doctors. I can only speak to my own practice at the Bay Medical Centre in Sandown and Shanklin. The e-consult system was working well for simple illnesses, but the fact that you cannot see your GP at the moment is increasing people's anxiety. And if I use an example, of my father. My father's been waiting for his hearing aids since February. Can't be sent to him, can't get an appointment, and that's increasing his own anxiety. So I think there is a balance between being COVID safe, but opening up some of the services again. And I think that does increase, through a different angle, increases people's mental health. And that is a concern to me, and my residents are raising that with me all the time. So I think that's an issue we need to look at as well, please.
Thank you for that, Paul. I think I've got Michael Lilly wants to make a comment, and if I've missed anybody else, I apologise. And I'm going to come to Michelle.
Okay, am I sort of live?
You will. You're certainly in view. Yes, you're live now.
Thank you. Yes, I had one or two comments. One, I think, in regard to young people, and I'll make a sort of declaration that I am a trustee, a long-term trustee of the Isle of Wight Youth Trust, that is one of the partners in a new school scheme with Bernardo's and Cam's and the team, which is an exciting project which will put a lot more support regarding mental health within schools, and I think Leslie can probably speak about.
Yeah, I'm going to ask Leslie to come in.
But one of the statistics that was very interesting from the Youth Trust during COVID was that a lot of young people were actually saying they were less anxious, and the factor was they weren't at school because their anxiety was actually linked to school and things like bullying in schools, etc. And that was actually relieved, which was quite an interesting factor. So a lot of young people who were asking for counselling said, actually, we're all right. We're actually quite happy. Now they're actually back at school and they're actually going back to pre-COVID anxiety, which is, the issues within the school. And I think that's just an interesting factor, and it's there's some very good study work from the Youth Trust. They did a survey on this, so that is available. I totally support what Councillor Modsell said about we can't underestimate the anxiety within the community. And I think the meeting yesterday with the Mental Health Alliance was extremely good, and that actually particularly linked with the importance of the community hubs, which are the 26 that are being created across the island, and the public health team and the other mental health teams working through those hubs, because those hubs had established a very good telephone support service by local volunteers in the area. And there was one of the outcomes was looking at mental health champions that came through those hubs, that actually every district, you know, Knighton, Brightstone, etc., has a mental health champion on the ground around the community. And that was a very good idea that came out of that meeting, that we need to get that very locally, if not street by street, but from area that we've got, because COVID has forced people very much into a very localized micro bubble. Thank you.
Michael, thank you very much. And that was a good sweep on a number of areas actually that are important. I'm going to go now to Michelle, Ian Lloyd, and then Leslie, but I just want to speak before you speak, Leslie, because I'm really interested in that national funding. That's really interesting. So Michelle first, then Ian Lloyd, and then Leslie.
Thank you, Chair. I really appreciate actually the opportunity to speak about access to primary care. When we were right in the middle of the COVID first surge, we were mandated by NHS England to do telephone triage of all calls, and we are still actually mandated to do that. And why we do that is so that we can discuss people's symptoms with them on the phone. Now, a lot of people may not necessarily think of COVID when they have things like back pain, secondary to the amount of coughing they're doing and the fact that they've got a high fever as well. So we do that, we telephone all our patients that phone in, and then we decide which ones need a face-to-face consultation with either a GP or advanced nurse practitioner. We also have a whole cohort of people that we can see. And just so that people know that actually 50% of all consultations across the island from August onwards were actually face-to-face in primary care. Now, the example made by the councillor was firstly about e-consult, and yes, we are encouraging people to do e-consult, but we are there also for people on the phone, because obviously some people may not have internet access. And also of note, the example he used was audiology, and unfortunately that is actually not a primary care service, but everybody's obviously still catching up from the backlog of the 6 months or so where everything was suspended. And actually there are huge waits to catch up on some of those essential secondary care services, which is why when we look at the second surge, how we're going to try and manage that slightly differently with keeping some essential services going and not trying to shut everything down. So I would like to really reassure people that actually primary care is definitely open. We are trying to triage as much as we can on a day. We've actually increased our activity to before COVID. And bearing in mind that we have to phone everybody now, as well as seeing those that need seeing, we're actually busier than ever. Thank you, Chair. You're on mute, Chair. You're still on mute, Chair.
Yeah, my system's a bit slow here. It's coming from Knighton. Ian, are you available to speak next? And then I'm going to go back to Leslie.
I am, Chair, thank you, and hopefully I've appeared up on the screen. And it's just to highlight some aspects that we've learnt during the crisis response, particularly around the shielding, where anxiety was very prevalent in terms of the support needs that people had. And bearing in mind that we've had 5,400 shielded who were subjected to many months of having to self-isolate and be locked away, many of whom didn't want to go in the community, and it did have a very big impact on their mental well-being. One of the things we learned from that is about that keeping in touch and that ability, and it's what Councillor Lilly was referring to in terms of the mental health champions, that ability for people to have a regular contact, to feel as though they were still part of the community and supported, even though they were having to shut themselves away. I think it's fair to say as well that during the shielding episode, we were in a very fortunate position in terms of the time of the year. Being the summer season, the weather has a big impact in people's outlooks. Moving into the winter, perhaps we're going to have a different outlook in terms of that if people do have to be self-isolated and away from the community. So I think that just looking ahead and some factors we need to consider that could have a further impact on our population's mental well-being. We know as yet the crisis is still yet to be felt. So in terms of furlough, in terms of housing considerations with the court evictions and so forth, employment is going to put some greater pressure on some of our community's needs. And so mental health will be a very big factor to what we look at. And I think it's just to remind people as well through Simon Bryant and his colleagues, part of the provision we put in place to support the community as we moved away from the shielding back into re-engaging with the community was the anxiety support aspect, that hand-holding, where people still needed support to re-engage with the community, what we could do collectively as a system to help them with that. I just wanted to highlight that particular point. It's from those lessons learned that we've established some very good protocols, and with the community hubs and resilience, there is a good network out there. We just need to know where those people need that support so that we can match them to it.
Thank you, Ian. I wouldn't mind Maggie just coming in and making a comment, which she's already put in the chat line, but just explain that because that looks really interesting. And it also prompted in mind, Maggie, some benefits that we may receive from our engagement with Portsmouth, which you're already aware of. So that's a really useful comment, if you don't mind coming in before I go to Leslie.
Thanks, Chair. So I apologise that I wasn't anticipating the questions, so I haven't got all the data to be able to share with you. But I know you all understand and appreciate the mammoth task we've had at trying to restore the services that we provide, and we provided at certain levels before the COVID pandemic outbreak. So we have over the summer period, and we will continue to try and restore as many services as possible. And in some services, we're doing that extremely well. So our cancer services are currently exceeding the amount of appointments that we were able to give pre-COVID, because we have, as Michelle outlined, we've been able to change some of the pathways and the way that we've been able to allow patients to access our services. So I also know, for example, we've got some services which are in excess of 100% of the capacity that we had pre-COVID, again through a lot of the IT solutions that we've been able to bring online. However, there are certain services where we are struggling, and we will continue to struggle. Orthopedics is one of the biggest areas of concern to us, and you know, it's common sense reasons. We only have a small hospital here on the St Mary's site. We've got a certain amount of theatres, and with all of the cleaning now that we have to do, all of the social distancing that we have to do, all of the screening of patients before we can give them their treatments, etc., it is making it a very onerous process. But we have to abide by the most strict infection control measures in order to protect our community from cross-contamination, and also, as sadly we've seen in many trusts, outbreaks among staff groups, which again put great pressure on our services. What we can do is, and we have been doing throughout this period, is working with individuals, because you know, going through a patient treatment list is one thing where you get names and just periods of time on the list. When patients come to us and bring to life how they're being affected by that weight, then we will offer them as much support as we're able to. We're not alone in this. You only have to look at the news. You can see this across the across the NHS, and sadly the North West is being impacted again very seriously by loss of services due to the rise in the COVID numbers. We're working at ICS level. Many of us are facing the same issues in the same specialties, and we're trying to look at what we can do on a bigger scale to actually alleviate some of the pressures. Some of you may have seen the article in the county press yesterday about the number of our patients on island who are resisting or they hesitate before they will have treatments on the mainland. And again, that's a real concern for us, because the Department of Health has made available to all NHS trusts as much use of independent treatment centres as possible, and some of our colleagues on the mainland have been able to benefit from that. Unfortunately, we've set up a process here where we've got clinicians who are ringing everybody on the waiting list, but sadly a very large proportion of those contacts are refusing to go over to the mainland for treatments. So it's a moving beast. It's probably the thing that's keeping me awake most at nights. It's getting all of our attention, and anybody on this call, if they have constituents who speak to them about weights, please put them in touch with us, and on an individual case basis we'll see what we can do to support them.
Maggie, thank you very much. Just a one quick question. Obviously, I've not met Leslie before, but clearly she's a key player in your mental health team. And I'm just wondering if she, through you, because you're the lead on this, could come back to us in January, a bit of a mental health update, if that's okay with you. I'm particularly seeing this is an important topic, and I think we'll have more picture in January as we get through the depth of winter and we are in our maximum unemployment, etc. Would that cause you any problems, or would you be okay with that?
We'd be delighted to do that.
Right, I've just given you a task, Leslie. Sorry about that. Because I'm seeing three strands here. I'm going to bring Paul Brading back in a minute. The first one is the physical impact of COVID, which Simon does give us the briefing on the data and how things are being handled. And I think a further update through in January on that will be essential. The second one, which is why we've invited Norman on board, is the economic impact, and particularly in relation to the unemployment and how businesses themselves are being challenged. And I'm sure he'll be happy to come back in and give us an update on that picture. And then, as I say, the third element, which I think is crucial, is the mental impact on the well-being of the island. And I've seen Steve's comments, I've seen Paul's comments, I've listened to Claire, Michael, everybody can see this. So I think it only echoes what we believe to be the situation, that sitting underneath is this kind of underlying problem, which isn't easy to see, but will come out in different ways. And Maggie articulated it really well. So I'm thinking, we need to engage and educate our community on all of these three. And I'll be really grateful if we can get a presentation. Paul, I'm mindful that I said come back in. Do you want to come back in? Steve Crocker's gone, by the way.
I do, Chair. I just wanted to clarify, the point I raised was under the sort of the hidden mental health side of things that doesn't get recognised. Yeah, Maggie and Michelle, wasn't a criticism. You are in an incredibly difficult position. I imagine, it's the backlog. You're trying to deal with the backlog because if you don't, it'll get worse. You can't deal with the backlog safely. You got to do it properly. And it's like doctors are in an incredible difficult position at the moment, having to work under guidance from above. And it wasn't a criticism. And I'm incredibly proud of what you all do for the islanders. It's just really the hidden mental health aspect that you won't see. And it's little things like that that will spark someone into a mental health condition that they're not currently in. That frustration, of not being able to do what they want to do. So it could be, as the leader said, could be a bit of communication. This is why we're doing it this way. Some sort of communication piece might be good for the island in general, I think. But it wasn't a criticism of either of you. I promise you that. It's just trying to bring up something that wasn't there. Yeah. But so, communication, Dave, might be the key, I think.
Well, I think so. Because people can only find out through forums like this. It's not often I do this, but I'm going to invite Michael Lilly to come back in again, because Michael, you put something in the chat line. And it's really quite interesting, and I just don't know if I could ask you to summarise it briefly. Do you just want to verbally mention that, particularly in relation to the services and the COVID? It'd be really, I think that's a really good point you made there.
I just wanted to raise that in the report on mental health, there is a lot about the transformation of mental health services.
Yeah.
And actually, pre-COVID, there was, over the last sort of couple of years, a lot of discussion and a lot of issue about the need for improvement of mental health services on the Isle of Wight, and particularly the move from a bed culture, acute culture, to one of rehabilitation and back into the community. And I just wanted to highlight that even through COVID, Leslie and Maggie and all her team have actually kept on that path, and are actually showing results. The young people's work, the cooperation between the voluntary sector in the young people's work is a good example that they're actually getting funding. They're winning national funding for that transformation. I have been a very strong critique of the mental health services, but praise is due now that through this difficult time they are on track. And a big part in the report mentions woodlands. This is a very key cog. I can't overemphasize it, because it was a rehabilitation use. It was actually used as a secure ward, and that has had to change for a long time, and it will change on the 1st of April next year, and that will have a massive effect on changing the culture of mental health services on the island. And I think the meeting yesterday with all the different agencies was a very good example of that. There is a dialogue. In the past there's been discussions but no action, but now you are having dialogue with action and real listening. And I just wish to put that into context. And health scrutiny, that was very critical. You got to remember 2 years ago, the health scrutiny went to the select committee and to the government, and actually said it had no confidence in the mental health services. And that has completely changed, and health scrutiny at the last meeting signed off because NHS England said now that health scrutiny has to sign off anything particularly to do with mental health. It signed off with praise at its last meeting, and I just felt that the Health and Wellbeing Board needed to know that.
Yeah, thank you, Michael. I'm very mindful of time. I've got Simon will probably come back in before we finish, but I'd just like to propose, and if members are happy with this, that at the next meeting on the 28th of January, we have 3 distinct strategic updates. One from Simon on the physical latest COVID position, which is going to see us through the next few months. 2 from Norman on the economic position on the island, so that we can understand exactly where we are. And then Leslie from the mental health position, if you're happy with that, with Maggie's agreement, so that the board is able to get that strategic oversight. I mean, part of this meeting is all about sharing, partnership sharing, and I think that will give us all a very clear picture. And I would echo again the comment that Michelle's made about GPs certainly wanting to see people. At a meeting I had recently, they're very keen to, where they can, and they do prefer the face-to-face, and there are benefits which everybody knows. So I would be very supportive of that principle, but again, it's a concern and education thing. So with that, are members happy with that? Could you just open your mics and just say yes, or if you're not, if you could speak on my proposition.
Yes, I'm happy.
Yes.
Dave, can I just make one additional suggestion?
Yes.
So absolutely, and Leslie and Maggie lead the mental health kind of service piece incredibly well. It's just making sure that there's the mental health board met yesterday to bring in some of that wider thing. So just make sure that I link with Leslie and that, so we have a fuller report rather than just thinking on the service piece. Yeah,
no, I'm quite happy for you to do it as you wish, and certainly the aim of this is to give a big picture view. I'm not trying to deal with the detail. It's just that the island and we can understand where we are strategically. I mean, it all sounds really good, and some of the results we're really seeing for the island we've maintained. It's just we don't want to let our foot off the pedal at all. I think we need to be right on top of this for the interest of the community. So thank you very much for that, Simon. John, did you want to come in? John Metcalf, sorry.
Yeah, thank you, Chairman. I really did. Simon covered a lot of what I might have been going to say, but I think the one thing that I did want to say was, knowing where we are now in the middle of, in terms of the COVID cases and the way things are rising, I think we shouldn't lose sight of the fact that this is a great opportunity for us to build on the work that's already being done around mental health, but also think about what that might look like if we get into if we become a kind of higher alert level or a very high alert level, because that will bring significant tensions and significant worries for our community. And I think we're doing a piece of work now, and I think we'll share it with all the partners on the board about how we communicate those messages to communities to take advantage of the opportunity we've got at the moment now to get ourselves to the doctors and get ourselves into the hospital and make the most of those opportunities while we can, but at the same time building our own personal resilience in readiness for what may come in the winter. And I think there's some strong messaging that we need to do over the next certainly 6 weeks to be able to strengthen that message.
Thank you, John. And I'm sure you're happy to lead on the messaging side in due course. Give us an update. I don't know if I get to give the chief exec some tasks. I love it. It's really good.
Every day.
Right, so we've covered everything on the agenda. I'm aware we've got a couple of council members listening in because I saw Debbie and a couple. Are there any questions from any members who would like to ask a question? I'd happily deal with them now. Otherwise, we'll reaching the end of the meeting almost. Just checking. I didn't want anybody to feel they hadn't had a chance. Sarah, is anybody indicating a question at all? No, Debbie said no questions. Thank you. Okay, well, that sounds like we've covered everything. Can I thank the board, please, for their attendance and commitment and taking the time to keep both ourselves and the community informed. And we'll look forward to our next meeting, which is on the 28th of January. And on that basis, I'll call the meeting to a close. Thank you, everybody.
Thank you, Chair.